Okay, so let's talk about the arteries that pass through the superior aperture. There are 3 tributaries that come straight from the aortic arch. So here we have the aortic arch, and the first one over here, this is the brachiocephalic trunk. And next we have the left common carotid artery. And we have the left subclavian artery right here. And as we can see, the brachiocephalic trunk further divides into the right common carotid artery and the right subclavian artery. So here is the right common carotid artery. And this over here is the right subclavian artery. So these are the branches of the aortic arch. Now let's go into a little bit more detail. So we're going to be talking about the branches of all of these main arteries. So when we talk about the subclavian artery, they have 4 main branches. So let's change the image. So here we have an image of the superior aperture and the blood vessels that are coming out of it. So we were talking about the 4 branches of the subclavian, and there's probably other branches of the subclavian, but we're just concerned with these 4 at the moment because they're related to the superior aperture. As you can see, we also have this artery over here, but we're not going to be discussing that because it doesn't concern the superior aperture. 4 branches are the vertebral artery that we see over here, and this is both on the left and the right sides. So the vertebral artery on the left side is over here. And we have the internal thoracic artery. You can see that over here. And we have the thyrocervical trunk, which is the one that is more anterior, and we have this costocervical trunk. So one of these is this one, and this one moves posteriorly. So this one here is the thyrocervical trunk. And this one here is the costocervical trunk. So these are the 4 main branches of the subclavian artery. So the vertebral artery, it is a branch that starts at the lower border of the T1 vertebra from the first part of the subclavian artery. It ascends through the foramen of the transverse process of the cervical vertebra starting with C6. So as you can see, it's passing through here at C6. Its branches are the pericardiacophrenic artery and the anterior intercostal arteries. The pericardiacophrenic artery begins just below the first rib and supplies the fibrous and parietal layer of serous pericardia and the diaphragm. And the anterior intercostal arteries supply the anterior intercostal spaces. Next, we have the thyrocervical trunk. So the thyrocervical trunk is a branch of the first part of the subclavian artery near the medial border of the anterior scalene muscle. It gives off the inferior thyroid artery, the superficial cervical artery, the suprascapular artery. So let's write down its branches. So the inferior thyroid artery, it further gives off 2 more branches, the ascending cervical artery and the esophageal branch of the inferior thyroid artery. Finally, we have the costocervical trunk. The costocervical trunk arises from the posterior aspect of the second part of the subclavian artery. It is posterior to the anterior scalene on the right side and just medial to the anterior scalene muscle on the left side. So it only has two main branches, the deep cervical artery and the supreme intercostal artery, also known as the superior thoracic artery. And there you have it, the arteries that pass through the superior thoracic aperture.